Meet Dr. Smith. Just like all other medical providers, he's been trained to keep extensive documentation on each patient's care that has been provided or is needed. Sharing that documentation with the people who need it, the patients, insurance companies, claims processors, other caregivers, or sometimes others like attorneys or government authorities, has for ages been stored and exchanged with physical paper files and folders. This was not only time-consuming, but costly as well. Even with the advent of first-generation computer systems to submit claims data electronically, the cost to handle documents digitally was just too cost-prohibitive for most medical providers. But starting in the 1990s, with desktop computers becoming more viable, that all began to change. Access to systems that could track patients and easily submit claim data were now widely available. But yet, with all of this progress, Dr. Smith was still submitting medical documents to insurers with mainly a paper-based process, relying on printing and mailing or faxing. This would often add delays in handling and processing his claims and approvals for his patients' care. But by 1999, the internet had expanded exponentially, and the ability to use reliable connectivity along with automation in the provider's office made an integrated approach more realistic. With more cost-effective storage methods, the use of document management tools became much more viable to most providers. A surge of practice management systems with affordable desktop or office scanners to convert paper files into digital images and new programs emerged that could virtually eliminate using paper documents. Dr. Smith had hope. Submitting documentation for medical claims has always been a part of the claims process for providers like Dr. Smith. No matter what kind of claim, the demand was increasing. However, medical documentation for group health claims processes is often on an as-needed basis. But another line of insurance coverage had 90 to 95% of all claims submitted that needed supporting documentation. The industry turned their attention to property and casualty, specifically workers' compensation. With receivables often approaching 90 to 100 days because of the paper kerfuffle between parties, something had to be done. So in the early 2000s, a pilot program was begun to directly submit medical documents from a provider's office and deliver them electronically with the claim to the workers' compensation payer. Immediately, payers and providers saw more accurate interactions, less follow-up requests, and dramatically improved claims processing timelines. More providers and more payers began to clamor for these capabilities. But there was another barrier: available solutions. State regulators also took notice of these successes and began to discuss the need to mandate the electronic exchange of billing and documents. Texas began the revolution in 2008, and since then more states have joined in. The demand to assist providers like Dr. Smith with solutions to meet the new compliance standards spawned a new wave of innovation by PMS and clearinghouse suppliers to integrate e-billing and attachments into the day-to-day billing workflow and not as a standalone process. At the same time, providers began to ask, so why not make this work for all claims? One of those industry leaders were the folks at Jopari. So what happens once the billing data and attachments have been created by the provider customer? Then we go back to Dr. Smith's office as the interface to the payer takes over. The insurance payer can customize the integration to allow for connectivity methods and file formats to deliver documents, flexible claim and attachment association methods, generating delivery acknowledgments, payer-specific rules of required documentation, management of requests for additional information. Here's typically how this would flow. The 837 file is augmented with the appropriate association pointer to the documents related to that claim. The claims are delivered via the existing pathway today, thus not requiring any change to that process. The attachments are packaged up according to the payer's requirements, typically TIFF or PDF files. Then they are delivered to the document management system, OCR/scanning portal, or other point. Acknowledgements are generated for both the payer and provider to have full visibility to the fidelity of the process. The end result is that with fully documented claims, payers should be able to further expedite their processing and enhance their relationships with providers like Dr. Smith. And the most important benefit of this digital synergy between payer and providers is Dr. Smith's ability to now focus on delivering care to his patients versus dealing with the administrative headaches of getting paid for his services.